Hi, I'm Virgil. I work with pediatric cancer patients and their families. I'm here to help you understand a bit more about surgery and how it's used in the treatment of childhood cancer. Surgery is commonly performed as part of the diagnosis and treatment of certain types of cancer. Doctors who specialize in cancer surgery are known as surgical oncologists. The first step in cancer treatment is determining the diagnosis, which often involves a biopsy. In a biopsy, a small sample of the tumor is removed. Doctors may also collect tissue samples from other parts of the body to see if the cancer has spread. A doctor called a pathologist looks at the sample under a microscope to see if there are cancer cells and to identify the specific type of cancer. Sometimes doctors will remove the tumor during the same surgery as the biopsy. Whether or not surgery is used to treat cancer depends on many factors, including the type of cancer, where the cancer is located, and if the cancer has spread. When surgery is used to treat cancer, the doctor may remove the entire tumor or just part of the tumor, depending on the circumstances. Sometimes surgery is the only treatment needed for a patient with cancer. But depending on the type of cancer, chemotherapy or radiation may be used along with surgery. These treatments can be used before surgery to make the tumor smaller and easier to remove with surgery, or chemotherapy and radiation can be used after surgery to kill any cancer cells that are left behind. Tumors are often removed with open or conventional surgery. This surgery uses incisions to access a specific part of the body. Sometimes doctors can do surgeries with small incisions so that recovery is easier. This type of surgery is called minimally invasive surgery. Many patients have surgery to help with other types of cancer treatments and procedures. For example, doctors may implant a central line, which is a catheter in a vein in the chest. One type is a tunneled catheter, a flexible tube that stays under the skin. One end stays outside the skin to allow medicines to be given more easily without needle sticks. Another type is a subcutaneous infusoport, which is located completely under the skin. Medicine is given through the port through needle sticks after numbing the skin. Other patients may have a small tube called a G-tube placed in the stomach to help with nutrition until they're ready to eat normally again. Before any surgery, your doctor will explain what to expect and give you information to help you prepare. All surgeries are done with anesthesia. Anesthesia is medicine that keeps you from feeling pain during surgery. Two of the more common types of anesthesia are local or regional anesthesia, which works by causing a temporary numbness or loss of feeling in a specific area of the body, and general anesthesia, which causes a deep sleep. There's no feeling or awareness. This is only temporary for as long as is needed for the surgery. An anesthesiologist is a doctor who is specially trained to give these medicines and monitor patients during surgery. Patients will not be allowed to have anything to eat or drink for a period of time before surgery. With a full stomach, patients are more likely to get food or liquid in their lungs while under anesthesia. This could cause pneumonia or other health problems. Your hospital or clinic will give these NPO instructions, which is short for a Latin phrase that means nothing by mouth. Be sure to ask the care team about other medicines usually taken and if and how to take them before surgery. Each hospital has its own procedures for surgery. The care team will go over this information to help you know what to expect before, during, and after surgery. A child life specialist may offer help so that younger children can understand what will happen. The day of surgery will be different for each patient depending on age and health, the type of surgery, and how much time and monitoring is needed after surgery. Generally, the day of surgery will include a visit with the doctor and a medical exam to measure heart rate, blood pressure, and temperature. Other tests may include blood tests or x-rays. The patient is given hospital clothes to wear, and the nurse or doctor will examine the area of the body that will have surgery. An IV may be placed for anesthesia or fluid if one is not already present. Additionally, monitoring equipment will measure heart rate and blood pressure. Family members can often stay with patients until it's time to go back to the operating room. After surgery, the goal is to help the patient be as comfortable as possible and recover quickly to return to daily activities. The care team will give instructions for recovery, including what to do for pain, how to take care of the wound, how to spot infections, when to return to normal activities, and whether any follow-up care is needed, such as physical therapy or nutrition support. There are always risks with surgery, but for many patients, surgery is a key treatment in the fight against cancer. Your care team will help you decide if surgery is right for you. Surgery can seem scary, but knowing what to expect can help. Please remember, we are here to help you face pediatric cancer together.